Have you ever revised muscle origins and insertions, finally felt like you knew them, and then a week later realised it all gone? Or perhaps you can recognise the correct answer when you see it written down, but when somebody actually asks you directly where a muscle attaches, your mind suddenly goes completely blank. It doesn't necessarily mean you have a bad memory, and it certainly doesn't mean you're bad at anatomy. It may simply mean that the way you're trying to learn anatomy is making it far harder than it needs to be. In this video, I'm going to explain why muscle origins and insertions can be so difficult to remember, the mistakes that many students and professionals make when revising them, and how you can start learning anatomy in a way that actually makes sense. Hi, I'm Jen. I'm a sports injury rehabilitation student, personal trainer, sports massage therapist, and biomechanics coach. Like many people working in healthcare, fitness, and rehabilitation, I've spent a lot of time learning anatomy, forgetting anatomy, and then having to learn it all over again. One of the biggest problems with learning origins and insertions is that they are often taught as isolated lists. You may be given the name of a muscle, followed by an origin, an insertion, an innervation, an action. And before you know it, you're reading the list several times, you're highlighting it, you're copying it into your notes. It starts to look familiar, so you're assuming that you know it. But familiarity is not the same as recall. When you repeatedly read the same information, your brain becomes very good at just recognizing it. You look at the page and think, yeah, I know that. But when you close the book and actually try to recall the answer without like any prompts, it's suddenly much more difficult. That's because recognizing the answer and retrieving the answer are two different tasks for your brain to complete. In an exam, a practical assessment, or a clinical conversation, you might need to retrieve that information yourself. The answer's not sitting in front of you waiting to be recognized. So one of the first changes you can make is to stop spending all your revision time rereading and start testing what you can actually recall. But recall alone is not enough. The second problem is that we often try to memorize attachments without first making sense of them. So if we take the biceps brachii as an example, most people remember that the biceps flexes the elbow. But if that is all you remember, the anatomy can start to feel like a collection of just random facts. The biceps brachii has two heads. The short head originates from the coracoid process of the scapula, and the long head originates from the supraglenoid tubercle of the scapula. The muscle then travels down the front of the upper arm and inserts onto the radial tuberosity, with the bicipital aponeurosis extending into the fascia of the forearm. Written as a list, that might feel like a lot of terminology to memorize, but let's take a closer look at the attachment points. The muscle begins on the scapula, crosses the shoulder joint, and then crosses the elbow before attaching onto the radius. That immediately gives us useful information because it crosses the elbow anteriorly, it can contribute to elbow flexion, but it attaches onto the radius, and that can also create supination of the forearm. And because it begins on the scapula and crosses the shoulder, it can assist with that movement as well. The actions are not random facts sitting underneath the attachment points. The actions come from the attachment points, the joints crossed, and the direction in which the muscle pulls. This is why I think learning anatomy becomes to feel much easier when you stop treating the origin, insertion, and action as like three completely separate pieces of information. They're connected. If you can see where a muscle begins, where it ends, and which joint it passes over, you can often begin to work out what that muscle is likely to do. You may still need to remember the specific anatomical language, but you're no longer relying entirely on your memory. You're also using understanding. Third problem is trying to learn too much all at once. And it can be tempting to decide that today is going to be the day that you're going to finally learn every muscle in the lower limb. You open a textbook, you make an enormous stack of flashcards and spend hours working through them. And by the end, you feel exhausted and you may actually remember very little of what you covered right at the start. Anatomy contains a huge amount of information. Like even within a single region, there might be multiple bones, landmarks, muscles, tendons, ligaments, nerves, and blood vessels. Trying to learn everything in one sitting creates a lot of competition between similar pieces of information. Instead, it's often more effective to learn anatomy in smaller, organized sections. For example, you might begin with the bones and the main landmarks around the shoulder, then learn a small group of muscles that attach to those landmarks. Once those feel familiar, you can add another group. This gives the information somewhere to fit. Rather than memorizing that a muscle attaches to a collection of unfamiliar words, you already understand the area of that skeleton that the words are describing, which brings us to another important point. If you do not know the bones and landmarks, learning muscle attachments just comes way harder. Imagine trying to learn that a muscle originates from the anterior superior iliac spine when you are not even completely confident about where the anterior superior iliac spine is. You're attempting to memorize a label without a clear mental picture of the structure. Before learning the muscles of a region, spend a bit more time becoming familiar with the bones. Look at the landmarks, find them on a diagram, a model, or even your own body if you can. Notice how they relate to another. And when you begin adding the muscles, the origin and insertion have an actual location rather than just being an abstract phrase. The fourth problem, only learning anatomy for an exam. When information has no use beyond passing the next assessment, it's very easy for the brain to decide, you know what, don't need to keep this. You revise it, you sit the exam, and then just gradually lose access to it. To retain anatomy, it helps to connect it to the work you actually want to do. For a personal trainer or a coach, that might mean looking at how the muscle contributes to an exercise. For a massage therapist, it might mean thinking about where the muscle sits, what tissues surround it, and which movements may load it. And for a physio or sports rehab student, it might mean connecting the anatomy to assessment, movement, injury, or even rehabilitation. Again, let's look at the glute med. So you could simply memorize that it originates from the external surface of the ilium and inserts into the greater trochanter of the femur. You could also look at where those points are, follow the direction of the fibers, and think about what happens when that muscle contracts. You can then connect that anatomy to hip abduction, control of the pelvis during walking and single leg activities. The information now has context, and that doesn't mean every anatomical detail has simple clinical application, and anatomy alone cannot tell us everything about pain, injury, or movement. But understanding the structure gives you a foundation for asking better questions. The final reason anatomy does not stick is we often leave too long between revision sessions. You might study a region intensely for a few days and then not look at it again for months. When you eventually return to it, it feels like you're beginning from the start every time. Forgetting is normal. The aim is not to learn something once and remember it perfectly forever. The aim is to revisit the information at useful intervals so that retrieving it becomes easier over time. That's where spaced repetition can be particularly helpful. Rather than reviewing every fact every day, spaced repetition brings information back as you're beginning to forget it. The things that you find difficult appear more frequently, and the things that you know well appear less often. That means you can spend more time on the anatomy that is not secure yet, rather than endlessly reviewing information you already know. So, how should you approach muscle origins insertions? Begin with a small anatomical region, learn the bones and landmarks first, add just a small manageable number of muscles, and look at where each muscle starts, where it finishes, which joint it crosses, and which direction in which it pulls. And just try to understand the action rather than memorizing it as an isolated fact. Then close your notes and test what you are actually able to recall. Finally, revisit the information regularly instead of trying to cram everything into one long session. You do not need to spend hours a day doing this. Even just 10 focus minutes can be useful when the revision is structured and consistent. This is the approach I've used when creating my anatomy lessons and Anki flashcard decks. The aim is not simply to give you another enormous list of origins and insertions. It is to help you organize the information, understand how the structures relate to one another, and build recall over time. In the next video, I'm going to take one specific muscle and show you how to move from its origin insertion to understanding, like, what does this muscle actually do? And if you'd like some help revising, I've also created anatomy Anki decks that you can use to practice muscle origins, insertions, actions, and innovations through spaced repetition. You'll find the link below this video, but for now, choose one muscle that you repeatedly forget, find its attachment points, look at the joints it crosses, and just ask yourself one simple question. If this muscle shortened, which direction would it pull? That question can turn anatomy from a list of facts into something that finally begins to make sense.